If a mom feels like something is wrong, she should follow her instincts, whether it be tongue tie or anything, right? So always listen to your own instincts. There's a lot of controversy because there's a lot of people giving bad information, and there's other people who don't trust the good information because they haven't learned it yet.
Hey, Mama Bear. Welcome to the Breastfeeding with Confidence podcast. Do you dream of bonding with your baby through exclusive breastfeeding, but worry about breastfeeding pain or low milk supply? Maybe you're struggling with breastfeeding and no one seems to have any answers. I'm Jamie, doula, international board certified lactation consultant, and mom of 5, and I have been where you are. After working through painful latches, milk supply worries, and postpartum depression, and supporting countless mothers through their breastfeeding journeys for over 8 years, I'm here to tell you breastfeeding doesn't have to be perfect to be positive. Each week, I'll share breastfeeding tips to help you prevent and overcome unexpected breastfeeding challenges so you can actually enjoy bonding with your baby. If you are ready to shut out the toxic whispers of the world, embrace your God-given intuition, and release your inner fierce mama bear, grab some coffee or your favorite herbal tea and let's dive in. Today, we are joined by Lisa Paladino through the Tongue Tie Experts podcast and Instagram. And before we get started, I just want to make a quick disclaimer that we are going to give you a lot of information about tongue tie and tongue tie release today. And I want you to remember this is for informational and educational purposes only. Please remember this is not intended to diagnose, treat, or create a personalized care plan for you. If your baby does have a tongue tie and you need to create a personalized game plan for you and your baby, Lisa and I both do virtual consultations and are happy to talk with you about setting up an appointment and doing a one-on-one evaluation and creating your own personal care plan. Lisa, I'm so glad to have you here. Can you tell me a little bit about who you are, what you do, and your mission?
All right, you have like 3 weeks and I'll tell you everything. No. I am a certified nurse midwife, a lactation consultant, a registered nurse, a mom, a grandma, about to have my second grandchild. I'm so excited. She's 38 weeks with my granddaughter. And that's the most important thing that I've done. And that's where I got my motivation, because I did not have any assistance to breastfeed my babies when I was a young mom. Nobody knew what I know now that I knew. So I learned from my mistakes, and it motivated me to help others. I am in private practice in Keyport, New Jersey. I lived most of my life in Staten Island, New York. I've recently moved, and now I'm just working virtually because I don't have an office currently. But I'm the host and the person behind Tongue Tie Experts brand. I'm on Instagram. I sell courses for professionals and parents all about tongue tie and breastfeeding. And I love to teach. I love to lecture. And I love to hang out with new mamas and babies.
I love that. And I love to hear, it always seems like it's our own stories that are the catalysts for us getting into this work. And I'm sure there's people out there who that's not the case, but by and large, I feel like that is the reigning story. And I love that so many of us are able to take that struggle and turn it into something positive for other moms. So let's talk about tongue ties, because you are the tongue tie expert. And there is a lot of controversy about tongue ties, a lot of confusion about tongue ties. Some people will say your baby has a tongue tie. Some people will say your baby doesn't have a tongue tie. So what is your general advice for a mom who is struggling with latching? They're hearing about tongue ties maybe on the internet, on Google, social media, and they're like, okay, so I think my baby might have a tongue tie. What's the next step? Who do I go to? What do I do? Because some people say doctors don't care. Some people say, go get it released. What should their next step be?
Okay. So first of all, I like how you framed it to start from the mother's point of view, because if a mom feels like something is wrong, she should follow her instincts, whether it be tongue tie or anything, right? So always listen to your own instincts. There's a lot of controversy because there's a lot of people giving bad information, and there's other people who don't trust the good information because they haven't learned it yet. Most of us don't learn about this in school, right? So I went through 3 different professional educations: my nursing degree, my midwifery degree, and my lactation. And if I learned more than 1 page in a textbook about the what I would say the traditional taught tongue tie about anterior heart-shaped tongue. That was it. That was it. And anything beyond that was something that we just turned our noses or rolled our eyes at. And, you know, if any professionals are listening to me, I don't blame you. I was that person that was thinking to myself, why would so many babies need surgery to be able to do something natural? So I was there.
Yeah.
And I resisted. And then 1 week in my practice, I saw 3 babies that I could not help with what I knew. I used all the tools in my toolbox, and I am a damn good lactation consultant. I can get any baby to latch. That was my thing. And 1 week, 3 babies. And one of those babies, mama followed her instincts, went, got a release, and then came back to me and told me about it. And I was like, oh boy. I wasn't like, oh, you're crazy. I said to her, let me learn more. And that was the start of my journey.
I love to hear that because I think a lot of providers don't have that humility to be able to say, oh, okay, I see this is not going the way I learned. I had a situation with my son's pediatrician, only he didn't want to learn more. He was like, oh, okay, whatever, and moved on. And it was like, I want you to learn more. So I love that you had that humility.
Well, it's the learner in me. You know, it's really funny because this has nothing to do with tongue tie, but it has to do with being open to changing and being resilient in our knowledge. I had a conversation with my daughter who's about to have her baby about how she wants my husband and I to talk about the new baby with her son. She doesn't want us to say, oh, you're going to have to take care of your sister. That's something we all said, but my husband and I reacted differently. He got like, what do you mean you're going to tell me how to talk to my grandson? And but I was more like curious, like, wait a minute, let me think about that. So I think that all of us should have intellectual and emotional curiosity. You know, that sounds like a different subject matter altogether, but it's the same thing. And I could have put my arms crossed and said, no way, that couldn't have worked. It must be something else or whatever. But I always realize, and to this day, I realize I don't know what I don't know. And a lot of providers that parents listening to this podcast are going to face don't know what they don't know and don't care to know what they don't know. Maybe by no fault of their own. Maybe they don't have time. Maybe they don't have any opportunities for learning. So getting back to your original question, if you suspect that your baby has something wrong that's preventing a comfortable and efficient latch, meaning you're having any trouble breastfeeding, whether it be on your side or the baby's side, I always recommend a functional evaluation. Now, a functional evaluation is not the dentist with the laser. It's not the ENT. It's not the pediatrician. It's someone who understands how the tongue is supposed to move, how the whole oral structure is supposed to work, what a feeding should look like, sound like, and feel like on all parts of the dyad. So dyad meaning mother baby. I also go more than that and talk about I take care of 3 patients, the mother, the baby, and the feeding, right? So as a lactation consultant, we learn the function of a breastfeeding baby on the mother and what the feeding is like. Speech language pathologists who are trained in oral motor and understand how the tongue, you know, works with feeding, especially those who've had breastfeeding experience, can help too, but they're not evaluating mom.
Yeah,
Right.
I think that's a really important distinction because I do talk with a lot of people who are like, oh, well, I'm seeing a lactation consultant and an SLP and this and that. And I've had SLPs that I've worked with and from like they were my patient, right? And they tell me I've learned how to do all of this with bottle feeding, but it's not translate. They're like learning firsthand. I thought this would translate to breastfeeding, but it doesn't.
Right.
And so I think it's so important to make that distinction that we need to have that functional evaluation within the context of breastfeeding from both and babies' perspective.
Right. So if anybody is looking for help for tongue tie for older children, that's definitely speech language pathologist. If you're out of the realm of breastfeeding age, right? But even there, not every speech language pathologist understands feeding. They might have learned about it in school, but they specialize. So someone who's got oral motor therapy experience. You can also, and this is a little bit more tangential, if they are older and they're looking for a provider, there are myofunctional therapists who understand the way the tongue moves, but you would not want to do that for an infant, right? So you want to be really careful who you're seeing. So a functional evaluation. And why a functional evaluation? Because tongue tie is a diagnosis of function. It's not whether it looks like a tie. It's how the tongue works. And I teach this in my courses. Like, let's not ask, what does it look like? Ask what's going on, how it functions. Because I have seen tongues tied to the tip of the tip that should be the worst, quote unquote, tongue tie. And those babies are nursing fine and mom's got no pain, because it's not about the front of the tongue. Mostly it's about the back of the tongue, right? So if they may not have an attachment in the back, and they may be able to lift the back of the tongue. However, you can't tell that by looking, right? So the other thing is, this is where it's overdiagnosed and underdiagnosed. And that sounds like a contradiction, but it's true. Because if you're just lifting up the tongue, seeing a frenum and saying, oh, yes, there's a tongue tie, let's release it, that's overdiagnosis, because not all of those frenum that we see need to be released. That's the tricky part. So if you just go to a dentist who means very well, he's taken all his laser courses, he knows all his stuff, he can even ask you questions about function. A lot of the really good laser dentists that I have networked with and learned from ask the right questions, and they know their stuff. However, they still don't have the training, unless they've had additional training and are IBCLCs. They still don't know how to evaluate properly for function, and to know if it's the proper timing for that baby to have the release.
Yeah, I think that brings up such an important question that I get from a lot of moms. I have so many moms that I talk to, whether that's my patients, whether that's just moms who emailed me, DM me on Instagram, and they're like, my baby has a tongue tie. I want to release. My husband doesn't want to release, or some variation of that. And they're like, how do we know that this is the right thing to do? And a lot of times I'm like, well, obviously I can't tell you that without doing an evaluation, right? Like, I can't give you.
And even sometimes after doing the evaluation, there is no, this is an art and a science. It's not
so many layers to it. But I did have one mom that I worked with somewhat recently, and we were like, okay, so it looks like there probably is some type of tie here. This is what she was thinking. This is what she was concerned about. Her husband was a physician who was very like, I am not on board with this, like, but it's your decision. You do you. I'm just going to step back and not be involved in this. And it was like, okay. So we had conversations about it, and she messaged me and was like, I'm going to go get the release done. And I was like, why don't we slow down a minute?
Yeah.
Like, why don't we slow down a minute? Because I don't ever want a mom to make any decisions out of fear. I don't want you to release out of fear. I don't want you to not release out of fear. I think we need to look at a big picture before making those decisions. But I do have a lot of moms that are like, you know, people who have very analytical brains, they're like, okay, what am I looking for to know if I need to release? How do I know if this is a path I want to go down? So could you maybe, I know it's extremely nuanced, and I don't want anybody listening to think, oh, well, Jamie and Lisa said, if XYZ, go get a release. Like, we're not saying that at all. But what are the kind of things that you look at to say, yeah, you might be ready to go into a release. Maybe you want to wait.
I have a framework around this. What I always say is, number one, you want to make sure that there's nothing else causing the symptoms, right? So yes, there might be a frenum that looks restricted, but what else is going on? So for example, I've had patients who were mostly bottle feeding and would try to nurse once a day, and the baby couldn't latch. If we get the frenum cut, that baby's not automatically going to know how to breastfeed. Right. And no judgment against that mom is mostly bottle feeding. I don't mean any judgment. Absolutely. I'm just saying, if we're trying to teach a baby to breastfeed, cutting the frenum is not going to teach them to breastfeed. Right. That's number one. If we have a mom who is having challenges with her milk supply, cutting the frenum is not going to help the milk supply. It's not going to make the baby eat better. if she, so you want to make sure there's nothing else going on with the baby, like torticollis. Torticollis is a big one. And for those who don't know what torticollis is, it's difficulty turning more to one side or the other. So it's easier for them to turn to the left or to the right, depending on where the tension is in their neck. And I see many babies with torticollis, or even
a tongue-tied baby without torticollis.
I know. I mean,
some
form of it. And the other type, and I don't know if this is technically torticollis, and I always talk about the tension in the body with a disclaimer of, I am not a body worker. I'm not a chiropractor. I'm not a physical therapist. And I'm not an occupational therapist, but I've been working with babies for so long that I recognize when a baby can't have full range of motion. And if a baby can't put their neck back for some reason, and I've seen this a lot, difficulty not hyperextending, but just extending the neck back a little bit to come into the breast with their chin in and their nose out. If they can't do that, then you can cut all the frenums you want. They're not going to be able to do that. So tension in the body needs to be released in one form or another. And with my parents, I usually suggest to start with some type of body work if possible, even if that's the only, even if the only type of body work that's accessible to them is infant massage, right? Yeah. You can take anything, but I give them, in my practice, I have a list of local practitioners who I have experience with. So I give them a choice of cranial sacral therapist or occupational or PT or a CST provider who's also an SLP. Like, I'm very lucky I built up a network. But any other lactation consultant that you're using, especially if it's in a local place, they should be able to know. They should have a network. If you can't find anyone, think about the dentist you were going to go to for that release. Call their office and say, before I come to you, I want to have an evaluation. They should have a network of providers, because one of the questions I always get is, how do you find the right people?
Yeah.
Right.
And I'd like to say too, if your dentist doesn't say, oh, if they're just like, oh yeah, that's great, a lactation consultant's great, and they don't have somebody to refer you to, you might want to find another dentist.
Yeah. So you want to use a dentist who has a network, because then they get it. They get that they're not the biggest piece of the puzzle. And the dentist that I started out with and still network with mostly, he always says he's got the easiest job. The release is the easy part. It's the preparation before and after. So back to, okay, I think my baby's got a tongue tie. What should I do? You want to make sure that there's nothing else going on. You also want to make sure that the frenum is actually causing a problem. And that's where the functional evaluation comes from. And going down the rabbit hole, and I'm going to say it, we never want to release a tongue tie for future problems. So I get this question all the time. Everything's going perfectly with breastfeeding. I have no problems. My baby's gaining weight. I have no pain, but I don't want my baby to have a speech problem later. We do not release tongue ties for a future problem that does not exist, because there's just not enough evidence to say if that works or not.
Yeah. And I think that's such an important thing to talk about, because a lot of my clients will ask, like, well, what impact does this have in the future? And I think it's very important to understand the impact that it can have, and maybe use that as part of a decision making from the context of, we're having these issues now. I get a lot. I'm going to make sure I'm phrasing this the right way.
Right.
I have a lot of clients who will be like, okay, I'm having these issues, but we can't guarantee a release is going to fix it. But will it impact them down the road? And that's where I'll talk about to them about, like, you're right. We can never promise that a release is going to fix anything, even if we go step by step perfect, because I think there's just so many puzzle pieces that are not tangible, like just how mom and baby's nervous systems are responding to the system and everything. But if somebody's like, okay, like you said, everything's going perfectly. We don't have any functional issues, but we see this frenulum. Should we release? Because, and I'm like, I'm if everything's going fine now, I don't necessarily think getting a release is necessarily the best option. But keeping in mind that that is there, and if obvious issues come up down the road, remembering it could be related to that, I think is always wise.
Absolutely.
That being said, it's like, I feel like I'm talking in circles now. On the flip side, it's if we're having issues, but you're afraid, oh, this is I'm afraid that it might not resolve it. But then we think about all the future issues that are probably going to happen because we are having issues now. We know we're having issues now. That means there's a strong likelihood there's going to be continued functional issues in the future.
Right.
Then it might be a conversation worth having. This could have long-term impact.
Yeah. So it sounds confusing, but I'm following you because it's true. I mean, but the other thing is, and this is going to add more confusion. Half of the people that say everything's going fine, and then when I go down the list of signs and symptoms of tongue tie, they're like, oh yeah,
It's not really going fine.
not really going fine. It's not really going fine.
And I think all of this confusion suffices to say why it is so important that you need to be working with an expert in this. You need to be working with a professional. You can't be trying to DIY it. And I get it. I've been there where I DIY'd it because I didn't have anybody to give me those answers, right? My oldest, it was the pediatrician was basically like, you gave it a great shot, just switch to formula. Didn't even recommend exclusive pumping. And I had a great milk supply. Just, you're suffering, stop torturing yourself, go to formula. The lactation consultant kept shrugging her shoulders and be like, I don't know what the problem is. You're just sensitive.
Wow.
And, she told me I was sensitive because I'm a redhead. Like I hold on to that. I hold on to that with like vitriol.
Well, my first pediatrician told me I was starving my baby, and she had only lost 6% of her weight.
Oh, stop it.
Yeah. And I didn't know anything then. And when I learned that secret 8 to 10%, I ran and got her record and looked, and I cried.
Yeah.
She lost 6% of her weight.
It's insane the things these people will say. And that's the situation I was in. We lived in South Carolina at the time. I grew up in Maryland. My husband's military. It was not until my mom had to come. I always tell people a plane crash saved my life because my husband had to go clean up a plane crash. It's horrible and tragic. But that meant that he was so worried about me being alone that he called my mom. And my mom came and saw how much I was struggling and was like, well, our friends from back home had this same problem with their baby and this doctor helped them. Why are you not going there? And I was like, oh, there's people outside this little town who actually know what's going on. And so I did. I kind of DIY'd it. I rushed into a release. Thankfully, from the breastfeeding perspective, all went well. Rushing the release, it went okay for him. And that made me think for my next son that it was going to just be that easy as just getting a release. I found out really quickly that it wasn't the magic.
Yeah.
But all of that comes back to say, like, just because you don't have the resources near you, especially in 2025, does not mean you cannot get them.
Right. There are people like, you and myself who do virtual visits. I have an online course specifically about tongue tie for parents that I literally just poured out everything I would say to parents in my office into a course. But it's best to get one-on-one individual attention. But at least you know the questions to ask. And one of my handouts, as a matter of fact, maybe that we can link to that, Jamie, in your show notes. It's questions to ask a provider. Like, how do you know what to ask when you're looking for someone to take care of your baby with tongue tie? Like, one of the things that brought up was, do you have a network? Because if they don't, you're going to run the other way. Or
I love that.
Yeah.
I think, and this is what I tell moms with like the guides that I offer as well with latching and everything. It's not just about the resource solving your problems, right? Taking a class and having everything get fixed. It's about knowing how to advocate for your baby that you're working with. Whether that's me or whether that's somebody else, you need to know the questions to ask. And if you don't know the questions to ask, you're not going to get the results you're looking for.
Right. And unfortunately, sometimes this is a quick fix, but in the most cases, it's not. The key to having the most success, and by success, I define success with tongue tie as the mother and baby being able to reach their own goals.
Yes.
Right. So it's not everybody should breastfeed. It's reaching their own goals. Most of the women that come to me, their goal is exclusive breastfeeding. That's why they're coming to me. Success would be then she's nursing, it doesn't hurt, and it's easier for her because it's challenging to nurse a breastfeeding baby. And the baby is thriving. with times in between of happiness and, not so much reflux, and gas issues are gone, and baby's got some quiet playtime, not feeding all day long and all the things. So we would love for that to happen with a 10-minute office procedure. Just get the frenotomy and it's all better. And we used to think that was the case. Now, I've been doing this over 12 years, specializing in tongue tie. And in the beginning, we were advocating for everyone in the hospital to learn about tongue tie so we could release it then. And now I realize what a disaster that would have been, because we are releasing tongue ties that don't need to be released in a quick manner before the baby is ready, before the parents are ready, and interfering with those first couple of days of nursing. So now I take a more laid back, let's see what else we can do.
Yeah.
And if there is absolutely no way for that baby to nurse in the beginning, unable to transfer milk, there are some babies that can't latch at all. Mama not, being able to tolerate baby on her nipple at all because of the way the baby is chomping. And that was my daughter, my second daughter. Then we can do a release, but with anticipatory guidance of this might not be the be all and end all, and we may have to do another release later on.
Yeah. And I think that's really important to touch on. That's what I was thinking about when you said releasing in the hospital, is like, so many of the moms that I see are like, well, we had a release,
right?
And I don't understand why it's better or not better, and this and that. And I'm sitting there thinking to myself, like, I hate to be the bearer of bad news, but
Yeah.
I have to go through all of that again and start back to square one. And it's hard to think like, oh, I thought I did all the right things, and we went through this surgery just for it to not work and to have to do it again. So it is kind of one of those things. And even with my fifth baby, all my babies have been tied. I was tied. I'm pretty certain my husband has he won't admit it, but those conversations.
Yeah.
But even with her, with my fifth, it's like I knew, and you'll understand what I mean. But when I saw her ultrasound, I looked at my husband and I was like, pretty sure she's gonna be tied too, because her chin was so recessed. He was like, no way. And when she was born, it was like the first thing, like, I'm looking at, looking at what she does with her tongue. Like I'm not looking at her eyes. She's screaming. I'm looking, what are you doing with your tongue?
Yeah.
What am I about to get myself into here?
Yeah.
And then that first latch was hell. And I was like, thank God I am who I am and what I am now, because if that had been my first latch with my first baby, I would have never latched again. But we knew the techniques to use, and we didn't get the release until she was about 3 weeks old. We were able to enjoy breastfeeding during that time, even though it was hard. So I want moms listening to know that, like, what a tongue tie looks like, it's not black and white. So when you're asking that question of like, should I release or not, the answer is not going to be black and white.
Right. And then it's always your choice. You get all the information and make a decision. One thing I will say, and this might be a little controversial, there are people I know who don't want to do a procedure in their baby's mouth, but will have a circumcision.
I talk about this all the time. That is not controversial at all.
Okay. Because
controversial, but I welcome it.
Not pro or con against circumcision. All I will say is, if you have had a circumcision on your baby boy, or if you would have if your baby was a boy, this is nothing like that, and it's helping your baby for function. So you're doing something to help your baby do what they want to do. And if you look at a baby who is struggling to lift their tongue, especially with some of these like posterior ties with so much tension in the mouth that the baby cannot lift their tongue, and they're struggling to stay on the breast, and they're popping off, and they try again, and they try again, and they just can't. We are helping that baby achieve function. Yeah. So it's uncomfortable, but you're doing it for a reason, right? You would never,
Yeah, no, I do love that analogy. And I do talk about that a lot. I've talked about that on Instagram. I have not done an episode on it, so maybe I'll do an episode. Digging deeper into that.
About baby's pain. And I am an advocate for pain relief, both during the procedure and afterwards. There's lots of homeopathic remedies that you can use to prevent pain or at least minimize pain. Breast milk itself is pain relieving. I don't love giving tiny babies Tylenol, but you also don't want them to be in pain.
Yeah.
And
I think it comes back to that nervous system regulation,
Yeah.
knowing your options,
yeah,
knowing how to regulate your nervous system, knowing how to regulate your baby's nervous system. Because I'm as holistic as they come, extremely anti-Tylenol. And with every single one of my babies, I sent my husband to the store like the second day and was like, "Can you just grab some Tylenol for one
right.
dose, just so I can get them to calm down?" And
Yeah.
that was, and I think it's everything doesn't have to be black or white. I think we get so fixated sometimes on what's ideal and optimal that we try and turn everything into like to make it fit that. But
Mhm.
we really need to focus on the mom and the baby, their situation, their goals, and what's right for them. So
Yeah.
I really appreciate all of your insight. You have brought so much wisdom to this conversation. And for moms listening, I feel like we said a whole lot and nothing all at the same time,
Yeah,
right?
can I just make one more point about it? Like you just said, you sent your husband to the store, and this is one of the things that I teach both my patients that come to me and in my course. Be ready. Like be ready ahead of time. And I have a list of things to do ahead of time because I feel like the 24 hours after a release can make or break whether or not you think it's a success. So
Yeah.
you want to already know the exercises you're going to have to do, even practice them before. You want to discuss with your own provider what analgesia, what pain relief methods they suggest. You want to have food in the house, right? So many people travel to a doctor for the release far away. You don't want to be coming home and everybody's tired and hangry and you don't
Yeah.
even have food. You want to think about if you have other children, childcare for those kids, maybe for like the next morning. This way you can you know what I mean? Think about being prepared. And when I say prepared, I don't just mean the baby, I mean the mama too.
Yeah.
And I love cranial sacral therapy for that nervous system regulation of mama and baby. And a lot of people will treat mom and baby. The other thing is that don't do this the day before their like baptism or something like that. Like do this
Or
like,
the day that the movers are clearing your
yeah,
house.
yeah, exactly. I mean, or it's some, your son's birthday party and you're having 40 toddlers over, like do this if you can at a time when it's almost going to be like a staycation for you. Like you're newly postpartum again, like you're just going to be laying around with the baby and just having, nursing on and off and relaxing, baths with the babies and stuff like that. I know that wasn't your question, but I think that's important and not enough people are talking about it.
It's so perfect. And that's so much of what I tell the moms I work with too, because I personally had my baby's tongue tie release done the same day the movers emptied my house out. Ended up having to sleep on the floor. And I really didn't have another option. Like it, their availability with our move and everything. And I could no longer tolerate what we were experiencing. But
I mean, everybody does what they have to do.
Exactly.
But there's got to be general
I
guidelines.
don't recommend it if you can avoid it, because I tell moms, I'm like, the day after your release or the day of your release is going to be the day that you question every decision you've ever made. You're going to think Janie is an idiot. Why did I listen to a word she said? I should have never done this. Like you're going to regret everything. And then it's going to get better. Hopefully we're doing everything right. And that is what so many of my moms will text me. They're like, you were right. Thank you for preparing me that this is going to be so hard, because everybody says it's a 10-minute procedure. And yeah, maybe in the office it is, but it's not.
Right.
It's not.
Right. And it's a journey after it's like a roller coaster. It will seem to be better and then it'll get worse again. And then it'll seem to be better and then it'll get worse again. You'll have good days and bad days, but it should trend towards better. And since I have been following or I've been suggesting these protocols that I suggest now to my patients, I have not had any reattachment.
That's amazing.
Because everyone is ready. Everybody knows what they're going to do, exercise and stretches wise, function wise. They've had the body work. And I used to have so much reattachment. We used to be much more aggressive with our exercises and, touching in the wound and things like that, which we're not anymore. And we have so much more success there. So you want to make sure you know what you're going to do afterwards. You're not going to learn that in the doctor's office right after the procedure, because you're not going to remember anything at that point.
Yeah. Oh, 100%. And there are still dentists saying, just rub the wound 3 times.
No rubbing.
I always prepare my moms ahead of time. Like, these are the exercises we're going to do. And like you said, we're going to practice it. We are going to keep practicing it so everybody's used to it. And it's not something new.
Right.
And we can feel just a little more confident.
Right.
That's what it's all about, is feeling a little more confident. You don't have to, it doesn't have to be perfect, but that confidence, that progress is really important.
The more you learn, the more you realize there is no perfect.
Yeah.
For those who hear people saying there's no research, there is, and there's more coming. I belong to an organization called ICAP, which is International Consortium of Ankyloglossia Professionals. I got that out. It's an international organization, and there's a whole research arm, and there's wonderful studies going on about aftercare. There are protocols. There are standards of care that are drawn up so that there is a consensus among multidisciplinary providers of what's the right thing to do for babies who are struggling.
Just because some people don't agree with that consensus doesn't mean that consensus doesn't exist.
Right. And then if you look at criticism of the field, the people criticizing tongue-tied field are saying there's no research because they're only looking at research by people in their own field.
Mm-hmm.
So there was just a position statement or some kind of statement from American Academy of Pediatrics, and all of their resources were from other pediatrician studies. So pediatricians aren't studying this.
Yeah. And I remember when that came out, I was actually at a local pediatric dentist, and I asked him, I was like, hey, did you see this? What are your thoughts on that? And he laughed. He was like, they're not taking into account anything that we see or say.
Right.
Why are we not pediatric professionals too? And I think that's, again, that it's eye-opening, and it's one of those things where it's like, we just need to take that as a.
Yeah. And also all of their references were ancient, right? So I know if I'm doing a presentation in my bibliography, I have to have most of my references within the last 5 years. And the majority of the references were like 18, 20 years ago. So, I'm like, all right, you want to be grown up, professional, and respected, but act like it, Jamie, this has been a blast. Thank you so much for having me.
Appreciate having you on here. I appreciate you coming on here. I really appreciate the wisdom that you've shared.
All right, Mama Bear, that is a wrap for today. If this episode helped you feel a little more confident or a little more prepared for breastfeeding, can I ask you a quick favor? Go ahead and leave me a review. It helps other moms find this podcast and join us in this amazing community of fierce and confident Mama Bears. And hey, if you know a friend who could use some encouragement or real talk about pregnancy, breastfeeding, and all things motherhood, share this episode with her. You've got this, Mama Bear. Trust your instincts, stay fierce, and I'll catch you in the next episode.